In today's video, we're going to be walking through the NDT approach versus the PNF, or Proprioceptive Neuromuscular Facilitation approach, and talking a little bit about how do we differentiate between these two. I do want to make clear, I'm not necessarily giving an extensive run through of NDT or PNF, just kind of my own thoughts on how I differentiate between these two. Let's start with NDT. NDT, or neurodevelopmental treatment, has a strong emphasis on normal tone and normal movement. Conversely, if you want normal movement, then the big emphasis for them is also avoiding or inhibiting abnormal movement or abnormal tone, abnormal primitive reflexes, anything that hinders normal movement. So there's an active avoidance of anything abnormal and a strong emphasis on trying to promote normal movement. Now, PNF is similar in the fact that they obviously want normal movement and normal tone. However, their approach is a little bit different. In that approach, it's okay to use primitive reflexes or abnormal tone as kind of a bridge to get to volitional movement and normal tone. Another difference is in NDT, the big intervention in NDT is the physical handling of a patient or client. And what I mean by that is, in their treatment, a lot of the emphasis is, again, on inhibiting abnormal tone, abnormal reflexes. So a lot of the training when it comes to NDT is about how the therapist uses their body to help promote a patient to weight bear or inhibit abnormal tone or primitive reflexes, and how to promote normal movement. Now, PNF is a little bit different because in PNF, the main treatment focus are these diagonal movement patterns, also known as mass movement patterns or total movement patterns. These movement patterns, in conjunction with high repetition and sensory stimulation via the visual system, the auditory system, the tactile system, these things are used to help, again, normalize muscle activation, normalize tone, so that coordination and fluidity of movement gets more effective and efficient over time. Therefore, you can kind of see the difference where in NDT, there's all these handling techniques to promote weight bearing, inhibit abnormal movements, promote normal movements. In PNF, the focus is really on diagonal movement patterns, and these are specific to PNF. So if you want to know more, you can dive into D1 versus D2 upper extremity patterns. It's a good place to start, especially for OT. Another big key difference is that the theoretical framework for NDT, or the theory of NDT, has a heavy emphasis on task practice or task-specific training, whereas PNF in and of itself does not have that same emphasis on task performance. And so NDT in some ways has kind of that occupation or functional framework built in, where PNF doesn't necessarily. Now in OT, I think, naturally we would use PNF in a functional way, or at least that would be the strong encouragement, because we know that we want to use these in conjunction with occupational engagement or activity engagement to make things a little bit more meaningful for patients. Not necessarily because that's part of the PNF framework, but because it's part of who we are as occupational therapists and our framework as OTs. There's two more things that I think is helpful to keep in mind about the NDT approach, or to be aware of at least. One is that it's also called the Bobath approach, so you may run into that terminology at times in research. And the second is that they are continuing to update their theoretical framework. Some of the research has not been favorable to NDT in the past, so again, they are continuing to develop as new research is coming out. So you may see continual changes to the NDT approach. I hope this video has been helpful to differentiate a little bit between the NDT approach versus the PNF approach. Hopefully it's a little bit clearer now for you. If you like videos like this, don't forget to click subscribe and like to be kept up to date regarding new videos coming out on this channel. If you have different details or things that you think would be helpful for others to be aware of about these two approaches, I always love when others share their knowledge down in the comment section down below, so feel free to do that. And thank you again for watching. I'll see you in the next video.